Hello everyone, I am Dr. Kavita Vishwakarma, a nephrologist and renal transplant physician based in Mumbai, India. I'm also a social media member for social media committee of Win Icon 2024. And this interview is a part of the series of pre-Congress interviews with our esteemed international faculty. And today I'm delighted to have with us Dr. Vathsala Atmaraman. Professor Vathsala is a professor and head Department of Medicine, National University of Singapore, and co-director of the National University Center for Organ Transplantation at the National University Hospital. She was the founding president of Society of Transplant of Singapore and has served as president as Asian Society of Transplant for 2 terms. She's had several papers, accolades, and she's been pioneering transplant in Singapore for last 3-4 decades. So we welcome Madam. Uh, Hello, Madam. Thank you for joining us. A hearty welcome to you.
Thank you,
Uh,
Dr. Kavita.
my first question to you, Madam, is what led you to nephrology and why not US? Why Singapore?
Sure. I'm an accidental nephrologist, as I have shared before. I had actually intended to train in cardiology. However, as part of my rotations, I ended up in nephrology uh, in between my membership from the Royal College and me taking up my training in cardiology. And of course, my head of the department said, you have to stay back for 6 months to a year because we need your services. So, but then, of course, I fell in love with transplant during that period. And certainly after that, I had no regrets joining the nephrology program as well as embarking on my career in transplantation.
Okay. And why not US? Why you chose Singapore?
Well, while I was in medical school, I actually met my husband to be. Uh, and of course, uh, I think I was uh, very much impressed by him. And certainly, right after medical school, I had to make a choice as to whether or not I wanted to come to Singapore or continue my further training in the United States. So the choice was obvious because my husband is a delightful man. And he's emergency physician and an expert in his own field. But I think more importantly, he's been a tremendous supporter in my career and my progression over the years. So I've had no regrets moving to Singapore. So I moved for family. But on the other hand, I think the environment I've been in Singapore has also been very supportive of my growth and training. For example, all my heads of departments and my bosses, I would say, have been extremely supportive. And I've had tremendous opportunities to advance in my career. Uh, and it has been a purely a meritocratic journey. And I feel with a combination of family support as well as support from colleagues and my institutions that I've worked with, it is obvious that this has really been the best place for me in my career.
So, Madam, you have founded nephrology in Singapore. You are a pioneer of transplant in Singapore, and you have been on the founding. You've been the founding president of transplant in Singapore, and you've served at various transplant committees. So, how challenging it has been for you as a woman to do all that, and how do you balance it?
Um, I would say it is challenging, but I have to acknowledge the support I've had from both my seniors, my peers, and my family in progressing in my career. But that doesn't mean that there are no challenges. The first challenge is to be recognized that transplantation uh, is is a very dynamic kind of career. You have to act fast, and I think sometimes I feel like I'm a half surgeon, a half urologist, and a half nephrologist. It's uh, you can't make decisions slowly. So in a way, you're competing in a world where there are very many active male participants in the program. So you have to be able to succeed in a fairly male-dominated transplant environment, at least a transplant academic environment. And I think if you look around you, you will see that in many of the countries, it had been at least historically a lot of men who were the leaders in transplantation. And I think increasingly we've seen greater participation by women in the field of transplantation, and that's universal. But it doesn't happen in isolation. It happens, of course, with support of family and friends, but it's and colleagues, but it also happens with an individual effort to succeed. The first important effort that important attribute that we need to have is, of course, excellence and meritocracy. We must be able to to compete at the international level academically uh, and in clinical expertise to succeed. That's the first and important thing. The second thing is to the word I want to use is lean in. That means you need to, I mean, every woman in whichever career that we embark in must put the utmost efforts. It is, I think, uh, understandable that even in places where there is meritocracy, women may be left behind. But there are several opportunities for advancement. For example, every opportunity that we are offered, we need to take up. Women often are reluctant in taking up leadership opportunities. I mean, I'm very proud to be part of this Win Icon 2024. I've participated in some of these seminars before, and I'm really grateful to Manisha for inviting me again. But you see, this, for example, participating in Win Icon is an opportunity, making efforts to participate in every opportunity to give talks or to train other individuals or to challenge oneself. Is if you want to go into a new area, are we as women hesitant about going into a new area because we're afraid of going into doing something new? We're afraid of not succeeding, afraid of not being able to get the maximal support. And these are the three things that I think we need to look at. Are we taking every opportunity that we have in getting ahead, right? And of course, you don't need to push anybody aside to get ahead, but are we putting ourselves forward? A lot of the time, I think women hesitate to take that plunge, to take that risk. But I submit to you and to the audience that there's always risk in everything. What is the worst thing that can happen? The worst thing that can happen is we fail. But when we fail, we can have the opportunity to rise again. And I think this is an important learning point that I've had, that whenever an opportunity came, uh, I took it, provided that, of course, I worked to get the support. The second thing is, um, I think we must also realize, for example, we often say there's a boys' club somewhere, but and there are some boys clubs you can't enter. For example, if you ask me, do I go out drinking beer with male colleagues? Of course not. But and of course there are, for example, some sports activities that men engage in that we don't necessarily participate in. But having said that, do we participate in all other activities that we can? Do we take up leadership positions when we are offered that option? Or do we stay back? And I think this is where I think we as women leaders in whichever specialty we're in, whether it is in medicine, whether it's in nephrology, whether it's in transplantation, we need to take up the flag and go ahead with it. In our own Indian history, as we know, we have had many women leaders, and I think we should acknowledge how they moved forward. They did not hesitate. And the third thing is how do we network with our own colleagues so that we can gain the maximum support. Um, I feel at times that we as women ourselves do not necessarily support each other in each other's journey uh, uh, to succeed. And I think we need to band together. And I think that's why we have programs like WIN and WIT, Women in Transplantation, that work towards supporting each other, mentoring women, or when women ask for help, reach out and help them. So I think this is a third facet that I want to highlight. And the fourth facet is actually gathering support. Learning how to gather support is very important. I find it's very important to gather support from my peers uh, uh, because uh, it doesn't matter whether they're male or female. Be committed to a single cause and work with each other. If they need help, I reach out and also help others. So it's only through collaboration with your peers that you can win support from each other. Uh, and don't knock anybody down on your way to the top. I think that's important because uh, I I get support from my secretary. My secretary makes sure that my calendar is cleared for today. That she has put the icon and the background for my for the Zoom interview today. So we need help along the way. So treat everybody well. So if I don't treat my secretary well, I think uh, with respect and professionalism, I believe that I would not succeed. I get a lot of help from family, as I said earlier. It's not just my husband. I train my sons to cook. Even when my eldest son was only 6 years old, he knew how to put macaroni or rice in the cooker and boil vegetables because sometimes I'd come back late from work after having gone for training in the US. And so somebody had to set the meal going, right? So train your children to be independent and self-reliant on each other and train your children. I think the other part is training your sons to be good supporters of their wives. I think when they see my husband supporting me in my career, uh, I think they have learned and supported their wives to in their career. So train your sons to be good house husbands while at the same time independent. So we need your family and not just your spouse or your partner. The third thing is use every reliant source of help. For example, I have had the same grocery person who supports my grocery needs for the last 20 years. So all I have to do is to place an order and the groceries arrive. And it's because of my trusted relationship with my grocery man, my trusted relationship with the laundry person, my trusted relationship with my renovator. So everybody, you build relationships for the long term, for sustainability, and with mutual respect so that when you're running your house, you learn to run your house. So yes, there are challenges in every aspect of our lives. And I would be remiss to say that one does not require talent in multiple domains to make it happen. But on the other hand, it's how we build our relationships with each other, with the other large network, and growing that network is so crucial. And I hope I have summarized the four important things. Have merit yourself. Second, take every opportunity. And I think the word lean in comes from Sheryl Sandberg, who put out that book on how women need to take advantage of every opportunity, view challenges as opportunities, and do not rest until, if you fall, you can only succeed if you keep trying. The third thing is, of course, uh, building networks. And four, treating everybody with respect and not using, but working with everyone in every domain or every aspect of your life. Thank you.
Very well said, madam. So my next question is that you have a very interesting talk in the upcoming Win Icon. Can you please share a glimpse of what you're going to talk about?
Um, what I'll be talking about is, of course, preemptive management of infections in transplantation. Of course, I will focus on kidney transplantation. I'll be using my lecture to briefly cover four areas. And one of the most important areas, of course, is how do you prepare an end-stage organ failure patient for transplantation in the first place by what I call not just preemptive management with vaccination, but also teaching them how to lead a healthy lifestyle, avoiding risks that contribute to infections. The second aspect of my talk will be on how to try to minimize donor transmission of infections. The third aspect is how you manage uh, either preemptive approaches or prophylactic approaches to preventing significant infections after transplantation. And finally, how and what one can do to minimize infections post-transplantation through several approaches. I mean, I think this is just a brief overview of what I propose to cover. Certainly, it's a very broad topic with multiple opportunities, but we must recall that infections are among the leading causes of patient mortality in our transplant patients. And so approaching this in a preemptive manner to and prevent infections is very crucial as our patient's journey towards uh, a successful life after transplantation.
Thank you, madam. That was a great interview. We are so delighted to have you for the Win Icon 2004, the upcoming conference. And I invite all of you to please be there. It is on 3rd and 4th August 2024 at Thiruvananthapuram, Kerala. Thank you.
Thank you.